Okay, I'm going to talk about a BE today. There's many different reasons we do this. We do it to look for colitis, diverticulum, and polyps, and inflammation of the colon. We also, instead of barium, we can use Gastro, which is an iodinated contrast, and we use that if there's a perforation of the bowel. We use it for pre and post-op surgery. We can also use it for therapeutic reasons. The patient also does have to go through a prep, which usually is like a 2-day prep, to cleanse their colon. They have like a liquid diet, a clear liquid diet for 2 days. They also go through laxatives, sometimes a suppository, and they can also do a cleansing enema if needed. Okay, so I'm going to set up for my BE. I have some gloves, we have tape, I have a chuck to lay down on the table in case the barium spills. I also have towels and extra washcloths. I have some KY jelly that we're going to use for the tip. I have some hemostats that are going to cut off the air supply once we inflate the cuff. So here I have my barium bag filled with barium. It's usually about 1,500 milliliters. I also have my air infuser, and we just should do a quick check to make sure the balloon inflates. Here's my air infuser. I'm going to just make sure that goes through. And also the barium we use for a double contrast study is 75 to 95% weight per volume. And now we're going to go get the patient. Okay, so my room is all set up for the BE. I have my chuck pad on the table. My fluoro is parked and my X-ray tube is parked. And now I'm going to go get my patient. Hi.
Hello.
My name's Katie. I'm going to be taking care of your exam today. What is your last name?
Vic.
And your birthday?
Andrea.
And your birthday?
3/16/89.
Okay, and you can go ahead and have a seat on the table. Have you ever had this procedure before?
No.
No? Okay. Is there any medication you're taking? No. Is there any chance you could be pregnant?
No.
Do you have any allergies?
No.
Okay, and why are we doing this today?
I just have some pain in my lower abdomen
Okay, and how long has this been going on?
for about a month.
Okay, and have you ever had any surgeries?
No.
Okay, so I'm going to explain the BE procedure. We're going to use this here. We're going to insert the tip into your rectum and then let the barium flow in and fill up your colon. We also may insert some air into it also, and so the doctor can look at your entire colon to see what's causing your problem today. Okay, for our first image for the BE series, we're going to do a KUB. So we're going to center at her crest, and we're going to use a 14x17 film. After that, I will go run my film. Next, I'm going to put her into the Sims position. So she's going to roll up onto her side, put her right leg over her left. Next, this is when we will insert the tip rectally about 3 to 4 inches. The barium should be kept at a low temperature so it's more soothing to the patient. The bag should be hung no higher than 24 inches. So then next I will inflate the cuff a little bit after inserting it. Next the doctor will come in and instruct me to let the barium flow in, and he will inflate the cuff more if needed. After he does all his fluoroing, I will do the overhead images. Okay, the doctor has done all his fluoroing, so now it's time to take my images. So for the first one, we're just going to do a KUB. It's going to be centered at the crest. Next, we're going to do an axial, which is going to be angled cephalically 30 to 40 degrees, and I'm going to center at the as-is for that one. Next, we're going to roll her into her RPO. So she's going to come up about 45 degrees, and we're going to, the central ray is going to enter through at the iliac crest. Next, we're going to do the LPO. So she's going to roll up 45 degrees that way. And we're going to center at the top of the iliac crest again. Next, okay, so now I'm going to do her lateral, which is going to be centered at the as-is. The next one is going to be her left lateral decube, which is going to be centered at the top of the crest, and the film is going to be in front of her and the beam shooting through her back. Next, we're going to have her roll over and do her right decube. We're going to center at the top of the crest for this one. We're going to have the film in the back, and we're going to shoot through the stomach. Next, she is going to roll onto her stomach. And all the while, we're going to have the tip in during all these images, being careful that it doesn't get pulled out. So now she's going to go all the way onto her stomach. She's going to be prone. For this one, we're going to take out the tube and do the cross-table rectum. So the film is going to be back here, and the tube is going to enter through here at her greater trochanter. After this image, she is going to evacuate her bowels, and we are going to come back and do just a regular APKUB centered at her crest. Okay, so now I'm going to talk about the KV for when the barium is in the colon. It's going to be anywhere from 90 to 110 kV. Your mass is anywhere from 30 to 80 kV. Make sure and double your mass on the laterals. Also for the cassette size, every picture is on a 14 by 17 except the lateral rectum, which you can do on a 10 by 12. For after the patient has voided, you're going to give them some aftercare instructions for when they go home. Let them know to drink extra fluids for the entire day and some for the next day. Double their intake of water. Also let them know that their stool could be discolored, and that's the end of the BE. Okay, now I'm going to talk about the images. I'm going to evaluate them. So our first picture was our Scout KV that we did. We look at the entire abdomen area to make sure that the colon is cleansed. And for that picture, our technique is going to be 80 kV at anywhere from 20 to 70 mass. Our next picture we did is the AP to show the entire colon. That's when the barium is inserted. The next picture we do is a left decube, and you can see the air fluid levels in the colon. Then we go ahead and do a right decube, and it shows the other side, the air fluid levels again. Then we also do a lateral rectum to look at the distal colon and the rectum. And then our final image is a post-void, and that just shows after the barium has been emptied out. And then there is some more images that some other doctors or facilities like. You can do an REO, LAO, LPO, and RPOs, and those look at the left and right flexures of the colon. You can also do the AP axial sigmoid to look at the sigmoid colon. There's also the Chessard-Lapine method, which looks at the rectosigmoid junction.